Finding a primary care physician is an important step in being proactive in your own health care. But how does someone go about doing this? We spoke to Dr. Joseph Pinzone, CEO and Medical Director of AMAI, and asked him to explain the role of a primary care physician.
So the role of the primary care physician in a patient's life is to really be a sounding board for all things medical. It's to help that patient to co-lead their medical management of all the different conditions they may face. The best way to search for a primary care physician is to start in your warm circle. That is the people that you're close to and that you know, and to get a recommendation and to really qualify that recommendation. What exactly about that doctor does the person you're talking to like? Is it the way the doctor relates? Is it their compassion? Is it a number of things? The number one quality you look for in a primary care physician is somebody with whom you can relate, who's easy to talk to. Very closely aligned with that is somebody who's very thoughtful and who doesn't rush you and who understands how to administer treatments in the context of your life. One of the strategies that you can use to qualify a doctor before you go to see that person, call the office. See what kind of a response you get from the front desk person. That will probably set the tone for your experience there. No matter what that response is, ask to talk to the nurse. If it's an office with multiple practitioners, ask the nurse, please tell me about the doctors there, I'm trying to pick one. And people will naturally have who they feel the best rise to the top in that conversation.
Dr. Pinzone talks about getting doctor referrals from your primary care physician.
A primary care physician is typically going to need to make one or more referrals during the time period that you see them. You may come up with a problem that requires expertise. The best way to approach that is to engage your doctor. Again, the main quality is that you're comfortable speaking to your doctor. So a simple question, why did you pick that person for me to go see? You want to be able to qualify that person, and the best person is the person who's making the referral. Ask your doctor about the different options.
How important is your doctor's education when looking for a physician?
Your doctor's education is part of who they are. It is a component. The better educated the doctor, in general, the more they've been exposed to research, and so they may often have a depth and breadth of thinking that their education helped to support. On the other hand, in these days in particular, what you also want to have in that doctor is the ability to make a plan and execute it. Follow it through on your behalf. You know when you find the right physician in the same way that you know when you found a good friend or spouse. It just fits. The relationship is easy, it's honest, it's open, and it's effective.
What are the patient's responsibilities in this relationship?
As the patient, your main responsibilities center around being honest, comprehensive, and feeling a sense of engagement and responsibility for your own health care, so that you really view your primary care physician as a co-leader with you in getting to a healthier place. The best piece of advice I have for picking the right doctor is to get in front of that person and to use your heart combined with your head. Have a sense of whether or not that person truly cares about what happens to you, and combine that with an analysis of whether or not that doctor can deliver on your behalf the health care that you need.